we're going to get started. Thank you for being here and joining us in this session called Beyond Words, the Power of Music, Therapy in Batten Disease Care. I'm going to introduce our speakers. First, Rebecca Atkins. Rebecca is a researcher at the Cambridge Institute of Music Therapy. She gained her PhD at the University of Brighton and is a neurological music therapist focused on pediatric brain injury, neurodegenerative conditions, acute care, and community rehabilitation. Leading an award-winning music therapy organization, Rebecca has led a team of music therapists and music practitioners developing innovative services throughout England. Under an Arts Council scholarship, Rebecca's PhD received a project investigated the impact of music and speech for the diagnosed of Batten disease. Her continued collaboration and affiliation with the UK and Europe research institutions sees Rebecca at the forefront of our current pioneer research in the art and health and music therapy sector for Batten disease. I'm going to also introduce you to Amanda Wick. Amanda Wick is a board-certified music therapist with over 6 years of clinical experience serving individuals across the St. Louis metropolitan area. She holds a Bachelor of Music Therapy from Illinois State University and a Master's of Music Therapy from Maryville University. Amanda delivers evidence-based, client-centered music therapy, serves both in person throughout Illinois and Missouri, and virtually to clients across the United States. Her clinical work spans a wide range of populations and settings, integrating research-informed interventions with compassionate care to support emotional, cognitive, and physical well-being throughout music. In addition to her clinical practice, Amanda serves as a clinical coordinator and adjunct professor at music therapy at Maryville University in St. Louis. In this role, she mentors and supervises emerging music therapists, bridging the academic training with real-world clinical applications. She is deeply committed to advancing the profession through education, supervision, and advocacy. So welcome our speakers.
Hi, everyone.
Hello, everyone. I think I might be a familiar face if you've seen me walking around in the last 24 hours. Predominantly spending my time in the children's room with the SIBS group as well. And with some adults this morning as well. Something I've noticed being here is the presence and care and intention of everyone to each other, to others' children's, and the connection everyone has here, which is so exciting and inspiring because you don't always see that in the day-to-day life. So how nice it is to come as a music therapist here and to bring that idea of presence and intention and care, which is at the core of what we do as therapists, into a place that already has that present. I do want to thank specifically Ethan's Reason. Ethan was a child affected by Batten disease, lost his life in 2013, who Ethan's Reason sponsored me to be able to come here today. Music is powerful, and music is present throughout all cultures. Although we would not say that it is has the same meaning across cultures, it does show up in all cultures with different meanings based on different aspects of music. The tone, the timbre, the speed, the tempo, the dynamics, the loudness, the keys, the scales. We see the benefits of music to help unite people, how music can move us and engage us in so many ways. And I thought to start off, I could play us a song I use with kids to work on things like emotion regulation, to help notice how your body is feeling and respond to it, for us to practice taking a mindful moment to just be within ourselves. When I'm not doing fine, keep this in mind. I can take a deep breath in. If I'm not doing well, I can be still and take a deep breath in. Breathing in, blow it out, in through your nose, out through your mouth. When I want to be fine, I keep this in mind. I can take a deep breath. And sometimes we might add something like move my body around, or put your hand on your heart, or other self-regulation like finger breathing, anything to help regulate. Let's do it once more. Breathing in, blowing out. Breathing in, blow it out. If I want to be fine, keep this in mind. Take a deep breath. Nice. So, as we mentioned, the title, Beyond Words, the Power of Music Therapy in Batten Disease Care. The purpose of this session is to explore how music therapy supports emotional, cognitive, physical, truly all areas of wellness, specifically for children affected by Batten disease. In this time together, we'll highlight a case study, look at some therapeutic techniques, recent research, and the impact of music in enhancing the quality of life and communication beyond traditional or typical treatments. So I'd like to play for us this video in a moment, which plays some music. It's a tango and an animation that's created based on data from an fMRI and computer modeling by this study done in Finland through multiple universities. The video here displays activation in the brain that happens while listening to this specific song, but in general, music as well, seeking to note the impact of timbre, which is like the quality or the uniqueness of someone's voice or instrument, tone, which has to do with notes based on certain keys or scales, and rhythm, which is the way we divide sound into beats, as well as just sound and time. So in this video, you may keep an eye on the red and the blue color. Red is for higher activation or heightened neuronal activity, and blue is a lower activation. But this is important because when you see those colors show up, it's showing that there's neurons firing, which can lead to like physical and like physiological changes, like things like heart rate, blood pressure, respiratory rate, but also things like arousal, emotion, cognition, mood. You may, if you are familiar with the brain, even notice what areas are being lit up. So we can play this video. You can cut it there. Anything that specifically stood out? Yeah. This could be different for each song, but I guess what I will say, based on what you said there, the fact you saw here in the middle, that's kind of your limbic system, if I'm reading it right. And that's kind of your emotional nervous system, which holds a lot of your emotion regulation and your some of your memories and things as well. Rebecca, can you speak on the frontal lobe and why people are noticing more activity there?
Sometimes, hi everyone, hopefully you can hear me okay from the UK.
UK, yes.
I think from England. I think sometimes music is linked with the prefrontal cortex or the frontal lobe because of the association with the planning and the organisation of music. And sometimes if we have an expectation of the types of rhythm or tones or melodies that are coming, that can activate the kind of planning and organisation sort of area of the brain. But also with this research study, I think the kind of main finding was that many different areas were simultaneously activated, whereas traditionally, I guess, music has always seemed to be processed in, like one side of the brain. You're either a musically minded person and you have that side of the brain activated, and this kind of challenged that perception, and all areas are kind of simultaneously activated with music. The question, Rebecca, is if you play music during a seizure, if that is advisable. I've not worked specifically with seizures,
So I'm not sure.
There is a condition called musicogenic epilepsy, where sometimes seizures can be triggered by sound, noise, or music. Other people who I've worked with who have seizures report different effects of music, so I would definitely caution that it's a different experience for everyone in that case.
I could see it being useful outside of the seizure itself to provide other benefits. That's what I would understand more as being common. Yeah, absolutely. So we pointed out a few areas that we saw light up here. And I think that brings us nicely into how music does light up the whole brain. As we know, more of the speech and language is stored on that left side of the brain. But as you've seen, music is showing up everywhere. So for someone who is a neurological music therapist like Rebecca, can use that knowledge to support speech or language rehabilitation with using music. So music therapy has many a benefit, and one benefit that I will use as an example right now is that music can be used to help with cognition, because music you can use as a mnemonic device. So my example I like to share, in my undergrad, we learned the definition of music therapy by making a song. So, music therapy is the clinical and evidence-based use of music interventions to accomplish individualized goals within a therapeutic relationship by a credentialed professional who has completed an approved music therapy program. Music, when paired with words or paired with something, can help you to recall. Music can promote wellness, supporting to manage stress, to alleviate pain. You can think of this in your own life, of how you use music in these ways. To express feelings, be it playing a song that you enjoy, to help really live in the moment of the emotion you're feeling, or to also help you shift emotions or shift your mood. Music therapy can help with enhancing memories. As we saw, the hippocampus, part of the limbic system, did light up in the first video. And to increase physical rehabilitation, as music also lights up motor-associated parts of the brain. The domain areas that, in some of Rebecca's and others' research, has been studied specifically with Batten disease, are these domain areas listed here. Music therapy is evidence-based, is clinically based, and is patient-specific. So when I'm talking about, we refer to research and evidence-based, and we base on the client's needs and the client's preferences, and we collect data to determine the effectiveness. So in the research with music therapy and Batten disease, we see emotionally the benefits, cognitively, in regards to someone's well-being, and in ways of improving communication and quality of life. And I'll give you some examples of this. Emotionally, we can tend to emotions by playing music that matches our mood to help validate our emotion, playing music that can help us shift our mood. And the principle we use in music therapy is called the isorhythmic principle. And you probably do this in your own life and you don't realize. But finding music that matches your current mood or energy state, and then allowing yourself to shift the music you're listening to move to a different energy or mood state, is a way to very naturally, without drugs and medicines shift your mood with minimal side effects that are negative, if any. Cognitively, music and memory, like the mnemonic I sang you with the definition of music therapy, memory books, activity songs, key phrases. One thing that you could do would be to pair songs with a certain task. Playing a song in the morning when the kids wake up, or singing them transition songs throughout the day as you go about the different things you're doing. Especially the challenging task. There's a little bit more of a reward and motivation when music is present. Physical well-being. Moving to music, it's intrinsically motivating and intrinsically wanting us to move to it, or using music as a reward. Communication. NMT works a lot, neurological music therapy works a lot to use the musical and the prosthetic parts of speech and language, and pairing that with music to help promote speech. For example, when I work with younger kids in groups, as opposed to saying, if you want this, say, I want cookie, I might rather go, if you want something, what do you say? I want cookie. More motivating. And it structures and guides them. Eventually you could take away the prompt with the music, and you might just say, if you want, and they may get to it. Or you just might hum and go, and they may say, I want cookie. Finally, quality of life. Music can be used for relaxation, stimulation, and comfort in our lives here, and can also be used with the children. I'd like to share this one quote, which is actually from Rebecca and some of her colleagues' research. The first quote is a popular adage, where words fail, music speaks. But the next quote says, to sustain communication when words alone no longer function, to give children and young people a medium through which to articulate their feelings when other channels of expression, emotional expression, are occluded, to enable memories to be accessed that would otherwise be lost, and above all, to help maintain a sense of well-being. Thinking back of the scans of the brain, thinking of the effects you see in children in your life when music is being played, you might see why this quote is very true. Rebecca.
Thank you, Amanda. I think my screen has cut out, so I'm just going to carry on. I can still hear you, so hopefully we'll be back live soon. So if you're looking at the slide with the onset of symptoms, I wanted to just provide an overview of a research study that Bengt Elmerskog and my colleagues ran back in 2019, where we interviewed over 180 parents and carers and staff members who were looking after children with Batten disease to find out their opinions, what was important to their children, how things kind of progressed for each of their children. And one of the really important kind of findings from the research showed that this is how generally children experience the onset of symptoms. And hopefully, as you can see, it might be slightly small text, but basically, normally the first thing that happens is children experience visual impairment, followed by some memory or cognitive issues. Then later, speech starts to decline, and then towards kind of 14 or 15 years of age for CLN3 children, physical movement declines. And part of this research also began to identify what therapy and education is available to these children over 7 countries in Europe and US. So I'm going to talk to the next slide now, Amanda, if you could move on. So some of the themes that also emerged from this research were around actually a lack of support for children, particularly in education approaches that were specific for Batten disease, and also therapies. And in most cases, support and education actually came from fellow parents and families rather than kind of professional medical trusts or education facilities. And there's a quote by Bills in 1998 who said, "Children with Batten disease are bright." And I always come back to that quote as quite important. It's one of the things that drives the research that I do. Could you do the next slide, please? So also the research revealed perspectives about what we understood children with Batten disease could understand or express. So one of the findings showed that they actually have a lot more understanding and comprehension than we ever kind of realised. A general trait of CLM3 is that speech tends to speed up. So sometimes children with Batten disease become quite difficult to understand. However, the research that we conducted here showed that actually their intention to communicate isn't lost. It's just that their expressive communication holds them back. So this graph shows that at the age of 7 years on the left-hand side, most parents say that their child's comprehension was on par with their children's expression, so they could say as much as they were understanding. But then as they moved through their journey with Batten disease, by the age of 22, you can see almost 74% of parents reported that their comprehension was actually better than their expressive language. So they were understanding a lot more than they were able to say. And this kind of challenged our ideas about how we could support a child with Batten. It was almost like they were becoming more locked in as the disease progressed. And we were kind of challenging those assumptions that their cognitive ability was declining as the disease progressed. Could I have the next slide, please? And can I just check that everyone can still hear me?
Yes. We got you. We can hear you. We're here.
I think that was a yes. I can't really hear anything. So one of the key findings from that study was that we need to look at a preemptive learning approach for children with Batten disease. So we need to hasten their learning and teach complex skills or essential skills when their learning is still possible. So we're kind of working on a precautionary approach and a proactive approach so that we instill things before those faculties start to decline. Could I have the next slide, please?
Yes, and we hear you fine, by the way.
Perfect, thank you. So something that was really unique in this first research study was the importance of music. And I like this quote that a parent gave to me a couple of months ago. They said, "Music and sound in general provide a gateway into the world, a way of interacting with the world, and a way of understanding the world." And something these initial surveys showed that was that the importance of music changes for children as they progress through their journey with Batten disease. And there were some unexpected results. Children used music in many areas of their lives. So if you can look at the slide with the graph that says the importance of music, parents and staff were asked to comment on their children's favourite activities or hobbies. And interestingly, between the ages of 7 and 9, the most important thing for children is sport and physical activity, the things that perhaps children are still able to engage with when they have their physical skills intact. Oh, can you still hear me?
Still hear ya.
Okay. You're there. Oh, I'm so sorry. I've been speaking to a blank screen for the last 10 minutes. I see everyone. So by the age of 22, you can see from this graph that music and listening to audiobooks became the most important thing to these children. So it may be in part due to the fact that those physical skills were declining, but the hearing was still intact. We know that children with Batten disease have a visual impairment, but they can still hear very well. So those things that they can hear are really important to them. And actually 91% of parents in that study said that music therapy was very important for a child with Batten disease, for their emotional well-being or for their functioning. So on the next slide, I'd like to talk about just the 3 very brief research areas that I've looked at. Okay. So,
Could you click it? Oh, there it is.
there we go. So between 2016 and 2019, we observed children in the UK having music therapy over the course of 3 years, they all had a diagnosis of Batten disease. And then in 2020, we trialled a music-specific program that children engaged with for a year. And then between 2020 and 24, we ran interviews with parents, carers, and staff members in the UK. So in this first phase, we identified this unique phenomena. Something happened that children showed signs of singing ability even when they'd completely sort of lost their speech, or their speech was really difficult to understand. And it seemed that music, memory, and language were really intrinsically linked. Even when they'd lost words, they could still sing. This is a girl, Olivia, who was part of the research, and I want to show you 2 videos where you can hopefully see this really clearly. The first video that you'll hear is Olivia just talking to her music therapist about trick-or-treating, and she was commenting that she went to a house and they ran out of sweets. And in the second video, you'll hear her singing along to one of her favourite tracks by an artist called Rihanna. So enjoy these videos.
Say that again.
I mean,
Enough.
no, they weren't.
Oh, no. That's no good, is it?
No. Staring myself in the mirror, apart piece by piece, sorrow decrease, pressure release, let it work, did more than all, now more than deserved. What did I want to flirt? Yes. When before a decision is this question first. Who am I living for? Is this my limit? Can I ignore some more? Is this a limit? Question existence.
So one thing that we noticed in a lot of the children in this first phase was that their articulation, their pace, and their pronunciation was brilliant when it was within a musical framework, so when they were singing a song. One of the other things that we noticed was when they were assessed against the Hamburg Clinical Scale, which is a scale that a lot of the clinical research uses to assess children with Batten disease. Over the 3-year period, they declined, so you can see that first graph at the top shows a downward trend. But when we assessed them within music therapy and we looked at observations around their communication and their mobility, we saw a more steady picture because actually we saw more skills were stable within a musical setting or a music therapy setting in particular. So this led us to the next slide where we talk about the Music Speaks program. So my team and I thought, okay, what would happen if children with Batten disease just engaged with music every day for 5 minutes and they engaged in a program that was meaningful for them, something that looked at using music to help them with meaningful phrases or words or important things to them. So the idea was to create songs that almost became earworms so that parts of these phrases in this music could be bespoke to each child and drawn upon when these children began to lose their speech. And in line with neurologic music therapy principles, the key parts of the phrases are at the end of the phrase. So as the music is concluding, that's where we have the most important phrases or words. And we assessed the outcome of this program by asking them to speak a phrase. Then we asked them to speak a phrase along to a metronome, and then we asked them to sing the song, and then we saw how this carried over after they finished the song and they said that phrase again. So this is an example that you can see their Friday song was about Friday food and drink. So the results showed that the program actually enhanced children's expressive communication each time they did it every day. So from the start before the song to after, they could be more clearly understood, they had better clarity, and their pacing was also better. Also, in this phase of the research, we saw that their receptive communication, so their understanding, was much better than what they were able to express. So this draws upon those results from that earlier research that showed that actually children with Batten disease are really understanding a lot more than they're able to communicate. And the staff members, so the teachers and the learning support assistants, also said that when the children tapped a rhythm and they were encouraged to speak along to a rhythm, it really helped them to slow them down and pace their speech, which really helped them to articulate what they were trying to say. So on the next slide here, we come into the final phase where we interviewed parents and carers and staff members, teachers who were supporting children with Batten disease. And we hit on really 3 key themes: that music was really important for caregiving, functional skill, and emotional well-being. And I just put a little quote. Oh, sorry, I've repeated that quote. I must really love that quote. We can revisit this again. Music and sounds in general provide a gateway into the world, a way of interacting and a way of understanding the world. So many of the people we interviewed said that music was useful for emotional and practical caregiving. So it supported their sense of self, it helped with their memories, and it also really helped them to maintain a sense of identity, something that's really hard to support for children with Batten disease who are finding it difficult to express themselves. We also heard that music helped families to maintain a sense of connection. So sometimes people had music sessions together, sometimes people had music with their music therapist for many, many years, and it helped them to celebrate life together whilst children were still living. We also heard, this is quite a key part of the research, that music helped with functional skills. So it helped things like their physical abilities. Quite often they would encourage children to clap or dance, sway along to music, which helped them to maintain their physical skills. We also have seen from Olivia that music can help with non-verbal communication through song lyrics, so singing helped them to often communicate what they needed to say through music. And a key thing we also heard was that music helped to mark points in the day where children needed help to understand their routine. So for instance, many parents and teachers used music to mark the beginning of the school day, or they used specific music for lunchtime or eating. We also heard almost from everyone that they used a specific song to go to bed, and it helped to trigger that association for a child who is not able to see and perhaps not able to express themselves, to know how they're moving through the day and how they're interacting with their own life, basically. And then lastly, and importantly, emotional well-being was really important. Music provided joy, comfort, emotional regulation, as we've heard from Amanda earlier today. It was used particularly during times where there might be painful procedures or personal care being delivered, and music was used as a distraction or anxiety soothing tool, and also, as I said, a kind of sensory anchor, so they could hear a familiar piece of music as they came into a particular place or a setting. And in a way, these interviews kind of wrapped up everything that we thought was happening and seeing in music therapy, and these interviews kind of gave us insight to that. Thank you. So it's important to kind of note here that in the UK, music therapy isn't part of standard care for children with Batten disease, or really for anyone with neurological conditions or complex needs. And importantly, to further build the picture as to the impact of music therapy, we're next looking at the physiological responses to music therapy. So you can see a picture of a sock there. We have a new smart device called a smart sock, and you put it on somebody, it's just like a normal sock, and it measures their heart rate and their electrodermal activity and also their temperature, and it can show us biomarkers of when people become agitated or they have anxiety or they're kind of getting distressed about something. So the next phase of our research looks at how music can respond to those things. So if we're measuring those biomarkers in children and we're noticing that they're becoming agitated or stressed, if we introduce music and music therapy, we want to see if that can bring them back down and kind of bring them back down to stasis, so we can maintain a sense of calm without needing to intervene or take it to a kind of next level of escalation. And it's really our goal to provide enough evidence to support the integration of music and other arts therapies into early intervention programs, so that music can help children really before they begin to lose their skills. So on this last slide, I just wanted to give thanks to the British Association of British Association of Music Therapy, and also the BDFA, who are the UK Batten Disease Family Association, and the other organisations there who have been a part of the research. And I just wanted to note that you might have seen some photos and images of children that you recognise, because almost all of the photos have been used from my time coming to the US for the BDSRA conferences. So I want to pay special thanks to those families and those children who have allowed us to share their stories and their images and how they connect with music. So special thanks to the BDSRA for inviting me this afternoon to speak, and I hope to come to my 4th US conference next time. So thank you, everyone, and I'll hand back over to Amanda.
Thank you, Rebecca. Yeah. We'd like to take the rest of our time to open up for questions. If you would use the microphone so Rebecca can hear you as well.
The only thing I wanted to ask is, I notice when the child is flailing, he's out of control, and the parents cannot relate to him, they don't know what he wants, and they're frustrated on how to handle it. Should they slap his hands, that kind of thing? I'm not saying they should do that, but that's what they wonder. Would you suggest that if a child is flailing like that and totally out of control, to use your voice to sing to them instead of talking? Would that get their attention more to find out to control themselves? Because to me, I notice that's when they're the most frustrated as parents.
Okay, yeah.
Otherwise they're extremely good with the child.
The question, Rebecca, is if a child is out of control, flailing, dysregulated, if using music or singing voice could be more beneficial than speaking? Yeah. My understanding with, looking at like autism research, that music comes through as a clearer signal. That may be true in this case as well. That,
You could say, well, don't do that.
yeah.
Would that
Yeah.
benefit better?
Okay, so could they respond, be a better response?
You would at least have their attention.
Yeah. Does music bring in there is a bigger response to music, typically, based on research, maybe not for every kid. There's more of a response to music. Music is pleasing, music is motivating, we know all these things, so I think it would likely be yes. Rebecca, if you had any thoughts on this question, I can repeat it if you need.
That's okay. Sorry.
I was just
Yep.
going to say, through terror, he sometimes pinches, scratches, acts out, and to anybody close to him, and that's the only thing that they don't know how to get control of that.
We're talking about like physical behaviors like pinching and scratching too, and how best we could manage that with music as well. Rebecca.
To speak to the earlier question, I think particularly for children with Batten disease and a lot of other children with complex needs, familiar music is also very important. So that can help in those moments of distress, agitation, or when you're seeing a behaviour escalate. Particularly for children who are losing their sense of self and their kind of sensory input visually, familiar music can be grounding. So if there's a piece of music that child connects to, and you can use it to signal, okay, this is our calming down time now, or we're moving away from the situation before we kind of see these escalating behaviours, that familiar routine of using the same song every time, something that's motivating or calming for that child, can be a really useful anchor for that child. And as I said, children with Batten disease, as Amanda said, children with autism or other complex needs as well.
Hi, how are you? My name's Ned Timmerman. I'm the father of Jack. He's CLN1. And it's interesting because Jack is a true lover of music. He lights up for U2, Coldplay. So my question is, how can we use the music that he loves and integrate that into other activities? And would that be beneficial to work into things like his physical therapy for rhythm and or stretching or timing or anything like that? And how can you speak to that?
Go ahead, Rebecca.
Yeah, I mean, it's great to hear about Jack's story and his love. I think I heard you too, and Coldplay.
You two and Coldplay, yes.
Great taste in music.
He may have gotten some of that from me.
So, as we've seen in the research so far, it can really help with those functional skills. So, sometimes as music therapists, we might advise on how physiotherapists can introduce music into their practice, sometimes to help motivate those exercises, which can be a bit mundane if you're just doing it in silence with a physiotherapist. Put it to a piece of music where there's kind of highs and lows or changes in music that mimic the movement, and we've seen that can really help with physical exercise. Also, you said, how can we integrate it into general activities? I think I would go back to those kind of anchor points. So if you have particular music that he loves to calm down to and relax, that could be a really nice way of introducing the end of the day kind of activities, or something that motivates him. We're going to go and do this activity now. This is the song that kind of signals that. And then as Jack progresses through his journey with Batten disease, those moments will stay with him, and those things will help him as he kind of progresses on his journey, to help him to understand kind of what's happening, and also help him to enjoy things around him as well. Back to you, Amanda.
Yeah, I actually spent time with Jack yesterday.
Oh, did you?
Yeah, he played on my guitar.
He's
Very good rhythm.
He's got a great smile, and he lights up for the music. One other question, because it's not just the soothing, calming, rhythmic music of Coldplay and U2, but when you turn the amplitude up a little bit on the rock and roll, how does that affect the brain? And when you see responses to louder musics or louder guitars, things like that, how does that affect the brain versus what we saw in our video earlier?
I'm not sure how to answer that question specifically, but I will say, relate it and humanize that question to everyone here, that when you like a song, what do? You turn it up. When you don't like a song, or when you're overstimulated in the car because the traffic, you turn it down. So if he's turning it up, or if he likes a certain song louder, maybe it's just an indication he really likes the song. That would be my first thought. But Rebecca, any thoughts?
Again, I'll come back to the familiar music. That's the thing that lights the brain up. We've seen that has the biggest impact. It's the biggest motivator, particularly with children. The things that they know, the things that they can learn and sing along to are the biggest motivating pieces of music. So keep up, U2 and Coldplay.
I'm also thinking, in his case, it seemed like music was a way of him communicating and engaging with me. So using music as at home, you didn't ask this, but I'm wondering, if you use it at home as a way to spend family time together, base it around music, making playlist of songs that help him go to sleep at night, or making playlist of songs that get him motivated for when he's going to something like sports or something. Could be something for the family, but also motivation for him to use on his own. Go ahead.
I'm a medical student. I'm just curious about what research or literature or any experiences there are, if any, about music in healthcare settings, and how we, as healthcare providers, can use it to make the experiences better for kiddos and their families.
Rebecca, I'll repeat. I don't know if you heard all that. The question of the use of music therapy, but also music in healthcare settings, which music therapists are employed in most children's hospitals I know of across the United States. And so we are present there in cancer centers, even in outpatient type centers as well. Rebecca, do you know anything about specific research on music therapy in medical settings or healthcare settings?
Well, the UK is bit further behind than the United States. I have to say we don't have a music therapist, unfortunately, in every hospital just yet, but we're working on it. And some of the research that I'm looking into is how music therapy can support places like acute wards. So for premature infants at the moment, we're seeing that the adoption of music therapy can help staff well-being when there's an environment of music. It can also help parents, help children. Sometimes, especially for children with conditions like Batten disease, the stays can be quite long-term. So things that really help their well-being whilst they're staying in for care can really help their well-being in that sense. I think there's a lot of research from the US, and if people would like to ask that afterwards, I'm sure we could find some literature.
Yeah, and in medical settings, if you, as a medical student or a medical provider, can always be to suggest the idea of other types of therapies, non-traditional therapies like music therapy, art therapy. They even have bibliotherapy now. There's a lot of different kinds of creative therapies, or even inviting a child who is agitated or anxious or in pain into a conversation about what music they enjoy, or prompting them to engage in music making or music listening for their own pain or stress management. Any other questions?
Any other questions? Well, thank you. Thank you so much for being here, Amanda and Rebecca. What a great session. And we also had two other sessions at your same time. So I think your session was really important for our conference, and I appreciate you both being here and speaking on this, and I hope you come again, and we'll have you as the only session. So thank you.
Thanks, y'all.